Hello everyone, my name is Ayana Shakin, and together with an amazing team of co-authors, Bogdan Vicescu, Randy Bradley, David Dobrakovsky, and Tonetta Smith, we will be presenting our paper examining the use of analytics in healthcare operations management, a systematic and narrative literature review. Our objective was simple: to synthesize a rapidly growing literature and make it easier for both scholars and practitioners to navigate these approaches, topics, and outlets in healthcare operations management analytics. So let's dive in. So our motivation was that the academic literature on the analytics in healthcare has exploded. Hospitals and systems were still struggling to turn data into action. So we identified that there's a persistent gap between promising research and what's implemented. Our own interactions with more than 1,300 practitioners in hands-on workshop reinforced that executives want actionable analytics but face organizational, cultural, and data hurdles. In addition to that, healthcare produces massive data, but adoption of analytics has been slower and more disappointing than hoped. So we set out to bridge that research practice gap with a systematic literature review and narrative synthesis. Specifically, we reviewed 414 articles published over the last 15 years in 5 leading operation management journals. We looked at Decision Sciences, Journal of Operation Management, Management Science, Manufacturing and Service Operation Management, and Production and Operation Management. We analyzed that at 3 levels. First, we started with topic. We used LDA on abstracts to identify 6 meaningful themes. In the interest of time, we won't go over all the themes, but we encourage to review the article. We also looked at the journal level, specifically how topics and approaches distribute by the outlet. And finally, we looked at the author level, tracking 925 unique authors by topic and journal. We also provided insight on analytics approaches and techniques used in research. A few key findings is that first, there is a clear growth. More than 80% of the studies were published after 2010, and predictive studies in particular rose steadily, peaking in 2024. Second, by approach, predictive dominates the field, with almost 60% of the studies being predictive, followed by prescriptive, and then descriptive studies are quite rare. Techniques differ by approach. Predicted work is heavily statistical, econometric, with a small but growing slice of machine learning, while prescriptive work is more method diverse: optimization, stochastic models, simulations, and game theory, reflecting the complexity of the decisions problems. Topic emphasis isn't uniform across journals. Depending on the journal, some of the studies publish more on schedule utilizations, others on clinical predictions, while Decision Sciences, for example, leans toward more policy-informing studies. Finally, the practice gap is real. Organizational and data fragmentation and limited integration across care settings make it hard to adopt analytics even when research models are strong. Overall, we really encourage you to review the paper. We sincerely thankful for Decision Sciences editorial team and the anonymous reviewers for their guidance and meaningful contributions to make the manuscript what it is.